Good evening and welcome to Fresh Natural Live. We have a great show as usual for you tonight. I hope your Monday. This is May 23rd, 2022. I hope it's going well for you. My Monday was busy. We're going to talk about a very common and important topic. It's going to be related to diabetes. And the topic's going to be related to inflammation and diabetes. And I hope to give you some insight in terms of the underlying cause of diabetes. Many people suffer from type 2 diabetes. The vast majority of people suffer from type 2 diabetes. There's a small percentage of people, approximately 5%, who suffer from type 1 diabetes. And it's really a common disorder that leads to lots of problems, leads to heart disease, stroke, peripheral vascular disease. It's one of the leading causes of amputation. And although there are lots of medications that are used to treat patients with type 2 diabetes as well as type 1 diabetes, there's a simple lifestyle approach that you can take. And what we're going to do is talk about the underlying mechanisms, because as I've said many times before, we should understand how our bodies work and how they function normally and how they malfunction. And so the important thing is to get this understanding. So we're going to share a lot of this with you tonight. Get your pen and pencils out. There's going to be some technical aspects of this talk, but I'm going to actually connect some concepts that are made with a previous talk. So stay tuned for our interesting show on diabetes. Okay, so as I said before, we're going to talk about diabetes, and I have a few interesting PowerPoint slides to share with you. But before we go on, I want you to give us a thumbs up. Let's all, on the count of 3, give us a thumbs up, thumbs up. If you hadn't had a chance to like and share this, please do so, and also subscribe. So 1, 2, 3, thumbs up, thumbs up. I see we get 1 heart here. Give us some love. Let us help steer that YouTube algorithm to get more people to look at our show. So before I go on with more discussion on our favorite topic, diabetes, because it's such a common disorder, and as a cardiologist, I get lots of patients that have problems with diabetes. I want to bring back a very special guest. And really, she isn't a guest. I mean, she was part of the panel. I don't think we've ever let her go because we hadn't even taken a picture off the intro. So anyway, without further ado, I want to introduce or reintroduce Isosa E. Isosa, how are you doing this evening? Oh, you're still on mute. I know you're going in and out of mute.
I'm good. How are you, Dr. Montgomery?
Just fine, just fine. Isosa is she and her fiance is visiting us here in Houston, and I had the pleasure to visit with them this weekend. We went to the farmers market. They've been doing some things around town, and they've got a special project. I'm not going to say anything about it because she says she don't want to talk about a project that hadn't started yet. So, but they have a special project they're going to be working on, and we're going to be giving you more information about that later in the year. But until then, we'll keep you in a little bit suspense. But Isosa decided to join us. She's in a Starbucks, so she's going to be going in and out of mute because there's a lot of activity behind her. But welcome back, and don't be such
Thank you.
Anyway, so what I'm going to do is part 1 of this discussion. I'm just going to give an overview on inflammation and diabetes. Now, remember, I think about 2 weeks ago, maybe 1 or 2 weeks ago, however long it was, we talked about inflammation in the heart. And now I'm talking about inflammation and diabetes, and I'm going to actually connect those two. In fact, I pulled one of the slides from that discussion and I put it in this slide deck, and I'll share that with you as we go through the conversation. But I think it's important for us to understand that these disease states are not all just separate, things going on. There's a common denominator to these disease states. So let's talk about inflammation in diabetes. And I want to underscore how to reverse it. Now, just getting to some of the basics, the two basic types of diabetes that we think about. Now, in medicine, we like to put things in little simple buckets, type 1, type 2, A, B, that type of thing. And even though this is a reasonable conceptual way of thinking about diabetes, you have primarily one where there's an impaired production of insulin, and primarily type 2, which is there's an impairment of response to insulin. There's a lot of overlap in both of these, and we'll talk about a little bit of that later. But type 1 is the lack of insulin production. It's caused by an immune-mediated mechanism. Now, keep your mind, put a pin in that. So there's an immune-mediated mechanism. The environmental triggers such as infection, nutrition, chemicals, etc., abnormal immune response that targets their own insulin-producing cells. So basically, your immune system, which is supposed to protect you, in this case, attacks you. And it attacks beta cells, which are the cells that produce insulin inside the pancreas. And hence, the pancreas doesn't produce adequate amounts of insulin. Now, when I was in medical school, we looked at type 1 diabetes, which was, childhood diabetes, or adolescent diabetes. And when I was on the pediatric ward, these kids would come in. They would come in with what's called diabetic ketoacidosis. We give them insulin, and we give them IV fluids. And in essence, what we would do is that we would bring down the acid level in the blood and get the blood sugar under control. And then they would go on insulin for the rest of their lives, quote unquote. And in this situation, we looked at it as an autoimmune reaction. Oftentimes, the kids would have what's called a viral syndrome, so flu-like symptoms, fever, chills, etc., a number of days prior to the onset of this. And so we would attribute it to this viral syndrome being some kind of an autoimmune mechanism attacking the pancreas, and hence the kid, after the pancreas is overwhelmed, the beta islet cells are either dead or very weak, and they're not producing insulin. Hence, the kids would require insulin infusion. Type 2 diabetes, on the other hand, is you can think of it as the opposite. So the pancreas theoretically makes insulin, and let's just say theoretically makes adequate insulin, although that's not necessarily true in the real world. But it's not so much the inability of the pancreas to make insulin, but it's an inability of the body's tissues, such as skeletal muscle and livers, to recognize the insulin. So when peripheral cells and tissues are resistant to insulin, they can't take in glucose. So basically, insulin is like the key that unlocks the glucose cells receptors. And so if you want to walk through a door, you have to have a key, unlock the door, and you walk through. The insulin molecules can be thought of as that key that unlocks the door opens, and the glucose walks through or passes through. And all cells have receptors that can communicate with the bloodstream, and molecules pass back and forth through these receptors. So insulin receptors or glucose receptors are very similar. So you have an insulin receptor adjacent to a glucose receptor, and so the insulin receptor is stimulated, the glucose door opens up, and the glucose passes through. If the insulin receptor is not stimulated, the glucose door doesn't open, so glucose can't pass through so easily. And so the glucose remains in the bloodstream, and therefore the blood glucose goes up. And so the insulin is an important molecule for that. So type 1, inadequate insulin production. Type 2, inadequate recognition of the insulin. And so glucose can't pass through. A good analogy would be if you have somebody in type 1, you have two people speaking to each other. In type 1, the speaker, the one talking to the other person, has a very low voice or no voice, and this person can't hear because no sound is going out. Type 2 would be this person speaks normally, but this person's hard of hearing. So adequate sound is going out, but it's not being received very well. So that's another analogy to think of it. Now, this latent autoimmune disease is kind of a 1.5 diabetes. We try to lump things in buckets. What I'm going to do is kind of give you a discussion of what this latent autoimmune disease is. But suffice it to say that 95% of people in the population have type 2 diabetes. And it used to be where children, if a child had diabetes, it was type 1 and type 2 is adult onset. We can't use those labels anymore because now more children are getting type 2 diabetes, and we'll talk about why. Here's a diagram showing a schematic in terms of the mechanism. So in type 1, you have the pancreatic islet cells. Okay, here's a normal islet cells, but then if they're attacked and destroyed by inflammatory molecules, antibodies, and immune cells, then these islet cells no longer function normally, so they don't produce adequate amounts of insulin, so you have lots of scarring there. So you have impaired insulin production. Type 2 diabetes, you have the pancreas and you're producing these insulin molecules, and here's the glucose molecules. So insulin moves glucose cells. Now here it's showing the insulin moving the cells into, it really has the insulin. This diagram is a little bit off because the insulin molecules attach to the cells and then allows the glucose molecules going through. But in general, the schematic is saying that the insulin allows the glucose to get across the cells, which is true. However, in type 2 diabetes, there's a resistance to insulin. And so the cells resist the insulin receptors, and so less glucose goes across, and you have increased glucose molecules left in the blood. So inflammation type 1, what I want to share with you is immune cells called macrophages release inflammatory molecules called cytokines. Hopefully, if you saw the talk that we did on inflammation of the heart, you may remember some of these terms, cytokines, for instance. And these cytokines are, as I said before, are signaling molecules that trigger more inflammatory responses. They call in more inflammation cells. Such molecules such as TNF alpha, IL-1 beta, and reactive oxygen species. These are free radicals here. This is a cytokine. These are cytokine-like molecules. And so they cause inflammation. It's a cascade of events. So it's like an alarm that goes off, and more fire trucks are called to the fire scene. Despite how big or small the fire is, you get an overwhelming response. Now, there are many pathways responsible for type 1 diabetes. Different trials that tested immune-modifying drugs. They're always looking for drugs to address these things. And so what happens is that they've looked at vitamin D analogs. Etanercept is an anti-TNF alpha drug that increases insulin production, lowers hemoglobin A1C. So you can get some drugs that has an interim effect. However, you may not get the overall benefit, and also drugs can have side effects. So those type 1 diabetes mellitus patients need insulin to regulate their blood. So typically, these individuals are on insulin for life. I will talk about some type 1 diabetic patients that I've treated before. I just threw in here a slide from a previous talk, and the reason I did this is to bring up some of the common things. Those of you who saw my heart failure inflammation talk may remember this slide. Excuse me. But what I want to do is talk about some of the same things. You have effectors of pro-inflammatory cytokines. Pro-inflammatory cytokines, what? IL-1 beta and TNF alpha. They also induce systolic and diastolic dysfunction. So these same cytokine mediators that have an effect on diabetes or have an effect on heart failure. And like I said before, acute heart failure is essentially a cytokine storm of the cardiovascular system. So if you think of the cytokine heart failure being a cytokine storm of the cardiovascular system, an acute onset of type 1 diabetes is a cytokine storm of the pancreas, or you could have the cytokine storm of the metabolic system. So I just threw that in there to show the connection. The effects of obesity and excess adipose tissue. It can have an adverse effect on the liver. Now, that's important because the liver is a major organ for metabolism. And diabetes, I often tell my patients, diabetes isn't a blood sugar disease, it's a metabolic disease, or it's a blood vessel disease and a metabolism disease. And the key center for that is liver dysfunction. And oftentimes, when I'm looking at evaluating patients, and they have some, insulin resistance. They may not have full-blown diabetes. They may have a little bit of lipid dysfunction. I'm looking at that collectively as a metabolic dysfunction related to liver dysfunction. And so then what are some of the issues you think about with liver dysfunction? Well, fatty liver buildup is an important thing. We're talking about a lot. You see a lot of people with, fatty liver. There's a fat buildup in the liver called steatosis. It contributes to steatosis. That's just a fancy medical term, which essentially results in congestion. You have bile duct and biliary flow. And when you impair biliary flow, you get steatosis. You can also have inflammation of the cells, the liver cells, the hepatic cells. And when they become inflammation, they have hepatitis. That's the term, inflammation of hepatocytes or liver cells. And then you can lead to progression of cirrhosis in the liver. So you have an early impairment of liver dysfunction, which contributes to metabolic dysfunction, which contributes to insulin resistance. You have fat accumulation in the pancreas, which can cause dysfunction in insulin. You have inflammatory cytokines that release and cause damage to the lining of arteries. We talked about that in our cardiovascular talk. And these cytokines inflame the myocardium. So when you look at a condition like diabetes, you say, well, okay, this person has diabetes. Well, they don't just have isolated problems. In the previous slides I gave you said, well, type 1 is, the pancreas is having trouble. And type 2, the liver and skeletal muscle are having problems. But it's not just those organs. Those are some key areas where you have a clinical manifestation of problems. But when you have this underlying inflammatory process, you have fatty buildup in multiple different organs. You have scar buildup in multiple different organs. And so there's a synergistic effect of dysfunction that's happening. And so what's happening is that these cytokines, TNF alpha, IL-6, IL-1 beta, reactive oxygen species, these are the same old characters. We saw them last time. We talked about inflammation of the heart. Now we're talking about them again with diabetes, type 1 and type 2. And so these inflammatory markers are happening at the cellular level. In this case, it's the beta cell. They lead to beta cell death. In the case of myocardial problems, heart failure, they lead to myocyte death, which leads to weak hearts or heart disease or heart attacks, etc., or heart rhythm problems. So you have the same underlying mechanism that's causing different disease states and resulting in different manifestations. TNF alpha causes peripheral insulin resistance. Studies show that IL-16 is a predictor of progression of type 2 diabetes. Visceral fat, fat around organs. Now, again, we talked about fat in the liver, fat in the pancreas, fat in the viscera. It produces pro-inflammatory cytokines like TNF alpha, IL-6, IL-1 beta, and reactive oxygen. Same old characters, same old characters. These guys they're like, Bonnie, Clyde, and, the gang of four going around causing disease all over the body, same old suspects. But what's leading to these suspects? Well, remember we talked about, in the other discussion, we talked about underlying mechanisms from the cellular standpoint. Let's look at the fat buildup. Why is it the body builds up fat? And why does the body swell in interstitial spaces? The body builds up fat because when we put toxins in our system at a rate that's fast and our body can remove the toxins, the body has to store the toxins within itself. So, for example, and I think I gave this analogy before. Let's say you have your house and your front and backyard, and normally you take your trash out, when you build up trash in the house and you put it in your trash can outdoors, and then the trash truck comes and picks it up once a week. So you have a certain amount of trash you put out. Now, I remember I had all four of my kids here. We used to have 2 trash cans out, and we'll fill up 2 trash cans. They come and dump out 2 trash cans. But if you have a lot of kids and a lot of trash coming in, so, you get tons and tons of trash coming in every day. You got to move the trash out of the house. You can't have it in the house. You got to get it out of the house. So you have to put it in trash cans, but the 2 trash cans fill up. You got to get more trash cans. And so you get so much trash that comes in the house. When you move it out, you got about 50 trash cans. So your house has 50, 60 trash cans around it. And maybe you got 60, 70 trash cans. But the trash man is only going to dump 1 or 2 at a time. So you build all these trash cans, you bring in more trash in, and you're unloading 2 trash cans a week. But you may be filling up 6 trash cans a week. So as you fill up 6 trash cans a week, you're only unloading 2. You're getting a net 4 trash cans per week. So every week you have to buy 4 new trash cans to fill up the trash. Well, guess what? These trash cans are analogous to the fat cells. So if you're putting in toxins from the bad food you're eating and soft drinks and other bad things you're taking in, you're putting in more toxin than the body can release. The body removes toxins through the GI system. It can remove it through the skin. You breathe out certain toxins. You remove it through the liver, the colon, intestines. And so you can only release or remove a certain amount of toxins. But if you're putting more toxin in, can you release, then you can remove, then the body has to store those toxins somewhere. Where do they store those toxins? Typically, fat cells is one common way. So the body creates more fat cells to put toxins in. But these toxic fat cells are pro-inflammatory in of themselves. So they release more, they trigger more inflammation because they're loaded with toxins. The body's immune system says, well, something smells bad around here. Let's go and find something to fight. And so you have these fat cells that you're building up, up, up. And so oftentimes people get fat, not only because they're consuming, excess calories, but it's really because they're consuming excess toxins. And it just so happened that high caloric foods or high toxic foods, so toxins are associated with the calories of the food. But you have a lot of people who reduce their calories, but they still build up waste because they may be still consuming toxic foods. And therefore, the body still has to stabilize or remove or neutralize these toxins. So that's what you're getting when you have this buildup of peripheral gut flora. Peripheral fat, fat both in organs and also fat in the viscera. Now, what about your gut flora, gut microbiota in type 2 diabetes? We talk about gut flora and the microbiome a fair amount. It's an important area. And if you remember when I talk about the mechanisms of disease, we talk about inflammation, we talk about oxidative stress. The other major mechanism, which may be more foundational than the first two, is the abnormal microbiome. And so our diet influences the composition of our gut flora. That's the bacteria found in the gastrointestinal system. Now, we have bacteria all over our body. We have probably about 10 times bacterial cells than we have innate human cells. And this microbiome, this ecosystem, if you will, is really important for our body's function. It's important for our normal body's function. The gut flora affects our immune system in the gut. The microbial products called lipopolysaccharides. Again, these are some molecules we can measure. They cause low-grade inflammation. I bet there are probably hundreds of other molecules that we don't measure or have yet to discover that contributes to inflammation as well. Patients with diabetes often have elevated lipopolysaccharide levels. So you want to reduce this. Now, they've done studies where you demonstrate fecal microbiome transplantation from lean donors to insulin-resistant subjects, resulting in improvement in metabolic syndrome. So, it's sort of, you got the fat diabetics taking crap off the skinny folks and getting better from it. But anyway, below are different ways to reduce lipopolysaccharides. You can consume prebiotics, consume probiotics, consume polyphenols and plant foods, consume omega-3 fatty acids. Well, guess what? And we can give you omega-3 fatty acids, but they're natural foods. Raw plants and seeds have omega-3 fatty acids. Raw plants are probiotics. And so, I hate to sound like a broken record, but when you eat raw plant-based foods, they're adequate probiotics and prebiotics. They feed the microbiome. And then when you take away the dead animal flesh, you take away the chemicals and processed foods, you do several things. One, the chemicals and processed foods and the animal protein contributes to an abnormal gut flora, first and foremost. Secondarily, they cause outward problems such as elevated blood pressure, arthritis, and other conditions that contributes to your need for pharmacological agents, which also have an adverse effect on the gut flora. So the consumption of a bad food diet contributes both directly to an adverse effect of the microbiome, but also indirectly because it forces you have to take other pharmacological agents that also have an adverse effect on the microbiome. For example, acetaminophen, from the drug Tylenol, people know, has an adverse effect on the microbiome, has abnormal effect on the mitochondria. So, drugs that we have to take for inflammation and other ailments, we can avoid having to take these drugs if our diet is optimal. We'll talk about that a little bit later. Well, short chain fatty acids also affect insulin resistance, but these are the good guys. So if you have healthy bacteria in the colon, they produce short chain fatty acids, and these improve glucose and insulin resistance. So it has a favorable effect. Foods that lead to production of short chain fatty acids in the colon, things such as resistant starches, onions, leeks, garlic, apples, asparagus, and oranges. You don't see cheeseburger on here, or barbecue or oxtails. These are things that you see that are all plant-based foods. So similar to inflammation type 1 diabetes and type 2 diabetes mellitus, immune cells called macrophages release inflammatory molecules that damage insulin-producing cells in the pancreas. So even though type 2 diabetes is primarily a mechanism of insulin resistance, the underlying inflammatory process that's affecting the liver, that's affecting the skeletal muscles, can also affect the pancreas. So patients with type 2 diabetes, even though theoretically they have insulin resistance, they also have an impairment of insulin production. It may not be as severe as someone with type 1 diabetes, in which case it's severe, sudden onset of inflammation, and it could be total destruction of the pancreas. And in many cases, it doesn't improve or recover. And so these people are on insulin lifelong. But an individual with type 2 can have a progressive destruction of the pancreas and beta cell dysfunction. And they can have sort of, as they call it, 1.5, to have both impairment of insulin and also insulin resistance. I've treated a number of patients who are kind of in this boat. And we sometimes struggle getting them off insulin because their pancreas, although it's not totally dead, it's severely impaired. When I work with these patients, I try to detox them aggressively to aggressively reduce the inflammatory process to help the pancreas recover. Some of these people who are considered adults with type 1 may not be fully adults with type 1. I remember treating a patient years ago who, and she was actually, I'm thinking in her, so this is back, she had an electrical disconnect there. She was in her maybe 20s, could have been mid 20s, late 20s. So she was labeled as a type 1 diabetic. And so I think she was in her 20s, maybe mid to late 20s. Anyway, so I saw her, and she came in and she was on insulin, and she said, well, I'm a type 1 diabetic. So I said, well, tell me about your history. So she said, well, yeah, when I was 8 years old or whatever, I was at, some event, a picnic or whatever with the family, and somebody checked my blood sugar. I just felt a little weak or something. They checked my blood sugar. It was like 500 to 600. So they took me to the doctor, and the doctor, you need insulin, and they said, you're type 1 diabetic. And so at that time, she was carrying the diagnosis of type 1 diabetes. So I said, well, I was a little skeptical because I know kids can get type 2 diabetes. So, okay, I'll tell you what, let's do this. Let's put you on a detox, and we'll check your insulin very closely. After the first week, her blood sugars were dropping. So I said, I'll tell you what, let's do this. Only give yourself insulin if your blood sugar is above 200. And we typically have a protocol that's similar to that. And we follow them weekly with intermittent phone calls, et cetera. She came back on week 2, after 2 weeks of detox. She had not taken insulin for that whole second week. And I told her, you're not a type 1 diabetic, you're type 2 diabetic. Because a true type 1 diabetic cannot go really 24, 36 hours without insulin, unless the blood sugar go up. And so she was a clear type 2, and I think she was always a type 2. Now, I've had some patients who we aggressively detox, and we have a harder time getting them off insulin. I think there's sort of a 1.5, and I think in some of them, we've had situations we've taken longer to get them off insulin, but we've been able to get them off insulin, and they're really a 1.5. But what happens is that they get recovery of the pancreas. And so even though the pancreas is impaired severely, and it can produce a small amount of insulin, but not enough for them to go off insulin, as we continue to detox, and the pancreas improves. So the inflammation and fatty infiltration of the pancreas allows the pancreas to recover. So in some cases, you have a combination of type 1, type 2, and in some cases, the pancreas is not all the way dead. It's weakened and impaired, it's overinflamed, but it can recover under the right conditions. And so although it's convenient to give these simple definitions and separations, it's always good to understand the underlying mechanism. Mechanism type 1 is impaired pancreatic function. Mechanism type 2 is impaired peripheral cell or tissue cell function, such as skeletal muscle and liver, that receives glucose. And so the impairment, the extent of the impairment is the key. So when you talk about reversing something, it depends on where you are. Can type 1 diabetes be reversed? Well, if it's a true type 1 and the pancreas is dead, let's say, for instance, somebody had the pancreas surgically removed, so it's no pancreas. Well, then, no, it can't be reversed. You don't have a pancreas. If you have an immune process that completely destroys the pancreas, knocks it out cold, and it's down for the punch, it's all scarred up, the beta cells are dead, not able to come back, then yeah, that's type 1, it can't come back. But you can have a severe type 1 where there's an ongoing immune process and the pancreas is very suppressed, and maybe the pancreas is hibernating where it produces tiny amounts of insulin or no insulin. But then let's say, for instance, under the right conditions, nutritional detox, anti-inflammatory diet, the inflammation goes away and that pancreas may come back to life. Can it come back to life to produce enough insulin for that person to go off insulin? Theoretically, it's possible. And so that's why I like to think of mechanism as opposed to saying, well, type 1, type 2, et cetera. Type 2, pure type 2, is very responsive to nutritional intervention. In fact, type 2 diabetes is probably one of the most responsive diseases to a plant-based diet that I know of. In that situation, insulin resistance can be reversed greatly with plant-based diet and natural things. But there are other things you can do. Exercise is important. As I said, consuming a plant-based diet can lower hemoglobin A1C. I've shown you our data where we put them on a defined plant-based diet. These are patients who are not type 2 diabetics but have insulin resistance. They have increased BMI, hypertension, hyperlipidemia. So they have that so-called metabolic syndrome. We've shown a 3.4% reduction in hemoglobin A1C in just 4 weeks. And that's because the fluctuations in blood sugar is reduced. And that's why you reduce the hemoglobin A1C in such a short period of time. It's important to consume a wide variety of vegetables, avoid consuming high glycemic index foods. Now, we are pretty liberal with the consumption of fruits early on with our diabetics. However, we see how they do, and most of the times they do pretty well. So we don't fuss over the glycemic index early on a raw detox. If they have trouble, then we'll back off on the high glycemic index foods. But that's just kind of a clinical judgment thing that we make in our facility. We try to avoid saturated fats, code term for animal fats, animal products, processed foods, and other refined sugars. Those things are abnormal chemical molecules. And so even though you may have something that's quote unquote vegan, it could be a processed food, it could be fried, overly microwave or whatever, and have chemical dyes, preservatives, etc., and could be very problematic. And exercise is very important. Exercise increases insulin receptor activity and decreases insulin resistance. And so exercise is very important. It has other metabolic benefits, detox, sweating, increased core temperature, and the like. So thanks for your attention, for putting up with another one of my interesting PowerPoint slides. I'm going to let us take a break here. So you have any comments real quick before we go to break, Sosa?
I just love what you were saying. Someone put a comment saying it was a really great explanation about storing fat and toxins. And I agree with that. I used to tell people before I became a nutritionist that weight was waste. And I feel like you just explained that in a really good way. Like people can understand that you can reduce your weight just by reducing your toxic intake.
Yeah, I think I agree. And I think we try to think of just burning calories. And I mean, calories are calories, but I think that the mechanism, the biochemistry of those calories are really important. And I think it's a good point. We're going to take a quick break. We're going to come back, and I hope you've been tracking some of the comments. We're going to track your comments and address any questions, and I'm going to get some more insight from Esosa. So hang on for part 2. Okay, we are back, and I want to say hello to everybody in the chat. We've got Elizabeth. Hello, Elizabeth from Barbara from Savannah, Georgia. Elizabeth, thanks for sharing. Regina from Missouri City here in Texas. Felicia is also from Missouri City. Sheila Lewis, we got Humble in the house. Miss Lewis, how are you doing? Deborah Payne. We have Goddess Purple Mom from Missouri City. I think Missouri City is all over the place here. Norma Aldain is from wherever. JW, she's from Boston. Hello. I know JW. Dan Little, how are you doing? Regina Coleman. Didn't know about liver dysfunction. Yeah, that's an important. Liver dysfunction is really, really important. And when you think about cholesterol abnormalities, blood sugar abnormalities, buildup in fat tissue, etc., you want to think about the liver. And oftentimes, and I have a great sensitivity to liver dysfunction because I think there's a liver dysfunction undergirds, I think, all of the metabolic disease and undergirds a lot of other diseases. And I'm sensitive to that because my mother died from liver failure and had progressive liver dysfunction. She was a type 2 diabetic, had high blood pressure, coronary disease, and she was on the so-called diabetic diet, plus all the standard medication, like 10 of her medications, or 8 out of the 10 of the medications were metabolized through the liver, plus you had the dead animal flesh food and all that on the so-called diabetic diet. And when she died, there was certain things, I won't go to the details, but she had to have an emergency surgery, and when they looked inside the system, she had liver cirrhosis. So she had progressive fatty liver buildup, and non-alcoholic steatohepatitis, leading to progression of inflammation, which had to have surgery for a brain tumor, which was easy to remove. She was put on medication that further, had to be removed from the liver, and it's kind of the straw that broke the camel's back. And so what we do is we look at liver dysfunction very carefully. So most physicians will just measure liver enzymes. And liver enzymes, in many cases, perhaps most cases, will not be elevated, because liver enzymes are elevated when the liver cells are inflamed, they're irritated. So they release enzymes. But the cells can be sick but not irritated. And so when the cells are sick, they're dysfunctional. So we check things like albumin level, because hepatic cells make protein, particularly albumin. We check PT and INR because those are coagulation markers. So there's an indirect way of looking at enzymes that are made for blood clotting. And we look at ammonia level. And so if the ammonia level is high, normal, or a little bit elevated, then that's a sign that there's some liver dysfunction, even though liver enzymes are normal. And I remember one patient shared with me, she saw a GI doctor, and then the GI doctor said, well, they did an imaging study and it shows some early signs of fatty liver, et cetera. But the GI doctor said, well, there's no problem with your liver because the enzymes are normal. But no, there's a problem. It's just that enzymes, can be normal, and you can have pretty advanced liver disease. And so that's one thing. It's really important to be concerned about liver dysfunction. So how do you stop liver dysfunction? Well, think about the medication you're taking in. You take a lot of acetaminophen. You're taking medication with chemical dyes, preservatives. Read the labels. See all those chemicals. Many of those things have to be broken down by the liver. So I don't know. It's also, what's been your experience with your clients on liver problems of life?
Well, I actually recently helped somebody go from really bad fatty liver situation to his enzymes being normal.
Mhm.
And really it was just, I mean, one, I had to make him stop drinking alcohol.
That's an obvious one there. Yeah, okay. Get off
Yeah,
the
I mean,
vodka every
so
night.
with the particular patient that I'm talking about, I had to observe what their body type was, and I observed that they were a body type that was extremely carb sensitive. So alcohol was a no-no, refined sugars, all that stuff. So we definitely had to control the way his, you know, the amount of sugar in his diet overall, including the alcohol, and then including in the plant-based diet stuff, exercise. It's really just the same stuff as as almost anything else. But
Yep.
within it's been a year, and now the enzymes are normalized, but it took even 3 months. Within 3 months he had lost like 20, 22 to 25 pounds.
Oh wow, that's
Yeah.
amazing. I bet a
Yeah.
lot of fat came off that liver too.
Yeah, a lot of it, for sure.
Indigo Fire wants to know where I'm located. I'm from Mars. I'm here visiting the planet Earth for just a few days. Now I'm located in Houston, Texas. I'll put that in the chat. Let's see. I think people can remember that, but I'll just put it in the chat anyway. And so, but thanks for asking. Let's see. Hello, Norma from Ontario, Canada. Uh, JW. Oh, JW Houston, Texas. Wait a minute. I got the wrong JW. Montgomery Heart and Wellness located in Houston, Texas. Okay, yeah. So JW is answering the other question. And Diane Little's laughing out loud. So the thing is that um, being aware of the underlying mechanisms of type 2 diabetes. So if you have family members with type 1 or type 2 diabetes, you really want to change their diet or encourage them to change their diet. And I strongly recommend a clean plant-based diet. If you go on our website, montgomeryheart.com jumpstart, there's a little detox protocol we have on our website. Just look at montgomeryheart.com and there's some information there. But just going to a plant-based diet, removing animal protein from the diet, removing processed carbohydrates, fried foods. I mean, you pretty much know what these foods are from your diet. You do that for a short period of time, you'll notice that your insulin requirements will go down, your diabetic pills will go down. Now, make sure you let your doctors know, because these changes can have very drastic change in the blood sugar. And if you're taking a large amount of insulin, you're going to have to come off the insulin, reduce the insulin. So make sure you work with your doctor on making these changes. But making these changes can be very, very helpful in terms of improving your overall well-being. A lot of what you're sharing about doctors misunderstanding labs is a big reason. I've always kept track of my own lab results. It's scary to think about conditions that may be missed. And again, and I'm not trying to be critical. I think, there's a lot, medicine is really difficult these days. I mean, I'm right in the thick of it. And, I have, mid-levels and cardiac nurse that sort of help me keep track of things, because, we're just inundated with just lots of things related to medicine. And it's really a bureaucratic business process. It's less about healing patients and more about, crazy stuff, third-party payers and the like. And so lots of doctors just caught in this, cycle of things. And I remember seeing one patient, and he came to office. He said, well, I did a telephone visit, a Zoom visit, televisit with the doctor, and they, we came online, and I could just tell the doctor was just not looking at my chart and asked me a few questions, and see you back in 6 months. And it's not a criticism, it's just the system that we're in. And what we've done at Montgomery Heart and Wellness, we created a condition where we have time to sit, with the patients and all. And some people complain about the weight and whatnot, and the complexities on each side. But we try to focus on, underlying mechanisms and talking to patients. And I know Isosa does a similar thing with her clients, but she's not caught in this vicious cycle that the rest of us are in. but still, it's the same process. So here's someone saying, Indigo 5, it's hard to do plant-based when you're told to give insulin by insulin to carb ratio. Yeah, Indigo, I don't want to give you instructions over the line. If you give us a call at 713-599-1144, or go on our website at montgomeryheart.com. You can reach out to our team or go to montgomeryheart.com/journey. You can connect with our community. We have a diabetes support group, but just connect with someone in our facility and we can maybe, arrange something where you get into one of our programs. If you're in the Houston area or can come to the Houston area, we can work with you. But suffice it to say, in this setting, there are ways around it. And I think you should find a doctor in your location who's willing to work with you on making simple lifestyle changes. We talk about aggressive lifestyle changes, raw detox, etc. But there are a lot of people make just simple exercising more, reducing processed foods, etc. You can make some simple lifestyle changes and reduce your requirement for insulin. But if you're type 2 diabetic, I really push that you try to minimize not only insulin, but other drugs, because the fewer medication you're taking, the better off you are. And that I say that, I'm not practicing medicine on YouTube, but I'm just saying that in general, you want to be on fewer medications as you can. Now, Mystic Seer Terra, can we eat Beyond Meat burgers? So Misty is a Beyond Meat burger fan. The answer is, well, you can eat Beyond Meat burgers because it's a free country. I don't recommend it, however, but I think it's not good for you. And I think I like that question, Mystic, because your question brings about an important point. Because a lot of people talk about vegan this and vegan that and vegan what. I can put you on a vegan diet and make you, more unhealthy than somebody's eating, oxtails and ribs every day, because you can have the wrong food. Bad food, by definition, is bad. And so the key is to avoid bad food of any type. So that's why I try to avoid the labels, that we talk about. I think plant foods are superior on the origin of a diet. That people that do well on diets that have healthy plant foods and they have minimal toxic foods and they get away with it or whatever the case is. So there's a whole spectrum of things. We use a plant-based diet for people who come in with severe diseases. And when we put them on a plant-based diet, we certainly don't just say vegan, but we define exactly what it is. But I don't like Beyond Meat burger. What do you think about Beyond Meat burgers, Sosa?
Well, there's the Beyond Meat and then there's the Impossible Burgers. And I just generally put that in a category of highly processed food in general. I find that if I'm trying to work with someone to heal something, I want to reduce their toxic load overall, just how we were talking about with weight loss. So I find that a lot of my patients who like to eat those things, it causes sometimes gastrointestinal problems and other issues like they're realizing they're having bloating or they're having weird stuff after they eat. Some don't even notice, actually. They just keep eating it. And then they're like, hey, I started to notice I have more gas or I have this. And then I'm like, wait, what are you eating? And it comes back to some of this over highly processed stuff. So I generally am trying to encourage them with stuff.
Yeah, I think yeah, we're there. No, it's excellent. You said, no, we got the whole point. Again, I agree with you. The toxins in the food is really critical. The toxins are, and it's not, and that's why I'm careful with the labels, because a lot of people, I've been eating vegan for X number of years and SOS, whatever. But you have a lot of preservatives and you're getting stuff out of cans and so on and so forth. So,
right at the end of the day, that was made in a lab. Like they literally had to make it. Like these fake meats are made in the lab, and they're trying to make it for people, meat eaters, and they're trying to simulate meat. But the things they have to do to simulate meat are very unnatural. So you have to think about it like, if I eat this, is my body gonna be like, WTF? Like, what is this? Like, what is this thing? Or is my body gonna be like, this is a potato, or this is, So if I know my body's gonna say WTF, I don't eat it.
What does WTF stand for anyway?
A bad word.
I'm
just
teasing.
Yeah.
So would you advise to eat meat substitutes without the carbs? No, I mean, I think Mystic mentioned without the bread. The bread is bad and the meat substitute is probably worse. So if somebody hands you a Beyond Burger sandwich, I would take off the buns. I would take off the tomatoes and whatever else is on it because it's been contaminated by the Beyond Meat burger. Then I'd take off the Beyond Meat. Then I'd wipe the plate off and throw it away. And so it's all contaminated. Beyond Burger, any thoughts? Stay away from it is my thought. That little number of people are in our community. Let me just give a word about our community. The Montgomery Heart Wellness Optimal Health Journey community. You can go to montgomeryheart.com/journey. I invite you to join the community. We actually have discussions like this where we go more in depth. We have guest speakers come and talk, give grand rounds. I have a Stump the Chump session once a month where you can ask me any question you want. And so we discuss a lot and give you a lot of content, the recipes and the special videos. So it's a much richer and in-depth discussion on topics in the support group. So if you have diabetes or heart disease or you have weight loss issues, then getting on Montgomery Heart community. And so go to montgomeryheart.com/journey and learn more about this program. So I think it'll be very helpful. Indigo Fire said, I think she's a type 1. Are beans okay to eat? Beans okay to eat, I think, in certain circumstances. It depends on how you prepare the beans, where you get them from, they're soaked or not. But generally, beans are thought to be very good. I eat a lot of sprouted beans. There are places you get nice sprouted beans. You can make sprouted bean salads. They're delicious. So I like sprouted beans. I don't know. What are your thoughts on beans?
Beans are great. Not everyone can, if someone is having digestive issues, sometimes they can't consume beans or they can't consume some of those highly fermentable foods. So we have to remove them for a while and see if we can get their gut back together and then bring that back if possible. But beans are great. I definitely agree that they should be soaked and they should be cooked in a certain way if you're going to cook them, so that you don't have as much issues with them when you eat them.
Okay. So
that next question, there was this one. That's a really good question. That's one thing I wanted to say was, from my perspective, because I deal with a lot of hormonal imbalance, even though my patients don't necessarily have diabetes, a lot of people with hormonal imbalance are insulin resistant. Women with PCOS are insulin resistant. And then when I'm dealing with estrogen dominance, I have to also consider insulin issues, because when there's higher levels of insulin, sex hormone binding globulin lowers, that protein that kind of grabs the excess androgens and estrogen. And so if I don't control the way people are taking in sugar, refined sugar, all that stuff, it actually increases their estrogen dominance or increases their androgen dominance, and then furthers their hormonal imbalance problems. So in this particular case, she's talking about stubborn belly fat and hormonal imbalance. One, she would need to figure out what kind of hormonal imbalance she has. Like, it's like, okay, are you estrogen dominant? Are you androgen dominant? Whatever. But the excessive belly fat a lot of times is also just adrenal related issues related to the liver and the adrenals. So that means usually people who are dealing with adrenal related issues need to actually do more relaxing exercise, not aggressive exercise, because they're in that fight or flight too much. They need to sometimes use adaptogens or other things to help them calm down during the day so that the stress doesn't process right into their system. And they also need to control their blood sugar levels by eating in a way, like almost eating in a way like as if you had diabetes, like just eating lower glycemic foods and things like that. Because if they're eating excessive alcohol or refined sugar, that's going to aggravate that. So those are the things that start to kind of work their way, that tire around the middle that people have. It's like, they actually using walking is really good, or yoga or other things like that, and then controlling how you're eating, and then dealing with whatever hormone. You have to figure out which hormonal imbalance you have.
Is ashwagandha an adaptogen that you like? You mentioned adaptogens for adrenal. Do you like to use ashwagandha as one?
So I've started to figure out which adaptogens are better for which clients based on, usually I use their dosha to figure out what might be better for them. I like rhodiola. I like ashwagandha. There's many of them. Holy basil. Gaia Herbs has a really nice general adrenal fatigue one, and it kind of has a mixture of a few, but it depends really on that person. That's why I always tell people to consult with someone, especially if they're considering taking herbs. Don't just go run out and get ashwagandha, because sometimes I have clients that are taking stuff and it's doing nothing for them, and that's just because they picked the wrong herb for them, not because the herb is bad.
Mm-hmm.
So you just got to know what works for you. I really like rhodiola for myself, and I have certain clients that work with rhodiola, and it works really well with kind of reducing your stress and keeping your mind really sharp. But again, different types of people work better with different types of herbs. One herb isn't one size fits all.
Gotcha. Makes sense. Makes perfect sense. Now, and also she mentioned eating clean. It depends on what you mean by eating clean, and fasting also can contribute to some of these stubborn weight loss issues. Uh, Toxins in the food. What's the best way to minimize toxins? I mean, I recommend people consume natural plant foods as close as their natural state as possible. So first of all, you want to try to get sustainably grown or organically grown plant foods in your community. Then when you bring them to your house, you want to consume them without, excess heating or, microwaving or et cetera, et cetera. Consume them as close to natural as possible. And the other thing is fasting, reduce your feeding state. So if you're just drinking water, maybe a distilled water or a well alkalinized water, and you're feasting only maybe 5 hours, or 4 hours, or 6 hours in a day, you have a longer fasting period so you can remove toxins from your system. We also use infrared sauna for our patients to help remove toxins through that mechanism. So there are a lot of ways to minimize toxins by not putting in processed foods or chemical foods or animal protein, and just consuming all natural plant foods. That's the approach we use. Okay. Bloating for me started when I stopped meat. Maybe it's the transition of legumes, tofu, etc. I've always had greens with meat. Maybe I'm eating too much fiber too soon. I mean, your body goes through a transition. So when you start, the bloating starts when you stop eating meat. Well, you have those abnormal, microbes in there, and then you start eating other foods, the legumes. I think Sosa mentioned soaking ahead of time. I've eaten a lot of raw plant foods. Also, food combination. Your food combining is an important issue. But transitioning to a plant-based diet can cause bloating because your gut flora is all jacked up, if you will. And so, your body's going to go through a transition. But some of the things I would consider doing is be careful with your food combining. You don't want to eat like fruits along with heavy meals that are slow transit. So most fruits are rapidly transit foods. So you eat those earlier. You may want to go with mono meals or posse meals. So, maybe one food at a time or maybe one or two foods at a time. So simple things like that I found to be helpful with the bloating. Any other thoughts, Sosa, on the bloating?
Well, when someone says bloating stop when they stop eating meat, I go, maybe your stomach acid might be low, or there's something else going on there where you weren't breaking stuff down right. So sometimes digestive enzymes and stuff can help people, especially if they're having issues. Like if you're seeing undigested, food in your stool or anything like that, you should definitely look into that and figure out, does my body have all the building blocks to break my food down properly? But
Yeah.
when I talk about bloating, there's so many issues that can come up. There's like, does this person have a candida problem? Do they have a parasite problem? Do they have low stomach acid? There's so many things that can come up just from the instance of bloating. And then, like you said, food combining is a big one too. A lot of people are just mixing all different types of foods together and expecting their body to be able to process it properly, and it can't. And so it causes discomfort and all that stuff. And a lot of women with hormonal issues, fibroids and stuff like this, have excessive bloating and gut issues. And so that actually comes from hormonal issues. And when we start to deal with the hormonal issues, their bloating goes away. So you got to look at where you are on the whole, issue with bloating.
Perfection. Yeah. No, that's a good point. Harold King, good info on diabetes. Will be 10 nutrition boot camps have an impact on heart failure. Okay, an occasional irregular rapid heartbeat, skip beats, normal, regular beat, So in fraction response, I think it's talking about ejection fraction. So from the heart standpoint, if you're looking at heart rhythm problems and the like, I think in my talk on inflammation of the heart, I touched upon some of the mechanisms of inflammation and increased oxidative stress. And what happens is that they've looked at that and they see how at the cellular level, increased oxidative stress and inflammation both causes an influx in calcium in the cells and also impairs sarcoplasmic reticulum function, which sort of modulates calcium function inside the cells. So that can lead to cardiac arrhythmias such as atrial fibrillation and cardiac and ventricular arrhythmias. It can also lead to weakening of the heart, which can decrease the ejection fraction. Skip beats are all rhythm related. So what you're seeing with these skip beats and abnormal heart rhythm is something related to inflammation, oxidative stress, and it affects the heart at the cellular level. And so we've seen patients whose atrial fibrillation is well controlled on a plant-based diet. I've had lots of patients with severe heart failure who typically are considered, if they're in atrial fibrillation, they're in chronic atrial fibrillation, and they can't be converted. But what I do is I put them on a raw detox diet, and their atrial are huge. And I put them on like an antiarrhythmic drug like amiodarone for a short period of time. The amiodarone has lots of side effects, but I do that temporarily. So then even though they're still in AFib on the detox diet, I'll then take them and I'll shock their hearts. I'll cardivert them, get them out of atrial fib and sinus rhythm. And as long as they're still on a plant-based diet, a clean, raw plant-based diet predominantly, then what we see is that the heart stays in sinus rhythm, the atrial shrinks a little bit, and I'm able to wean them off the amiodarone. And so we've seen that in a number of cases. And all that's happening is that the natural nutritional effects is enhancing heart function at the cellular level. So you're reversing some of the scarring, reversing some of the biochemical effects, reversing, mitochondria is becoming healthier, it's being fed. So more ATP production, fewer reactive oxygen species at the cellular level, fewer calcium influx, et cetera, et cetera, et cetera. So all these things can help with abnormal heart rhythm, and you can do that primarily with nutrition. And in fact, I think it's superior to the actual drugs from our experience. Ann Gray Smith is 16 years past double bypass surgery. Congratulations. I hope you're on a plant-based diet. I think anybody who's had bypass should be on a 100% plant-based diet, detoxing, etc. I really encourage anyone who isn't a member to join. Thanks, Age Olivet. Join the journey. Jack and Dr. Montgomery are so engaging. So it is, if you haven't heard, montgomeryheart.com/journey. Join the journey for as little as a cup of coffee a month. You can become an insider, but I recommend you invest 3 cups of coffee a month and become an inner circle member, and you get all the great information and much more detailed information. Like we try to help you become your own health expert. So join the journey. Join the community. I always cook and eat at home. That's actually a good exercise to do. You control your food. You control what goes in it. How to learn more about your program? Isosa, how do we learn more about your program?
Well,
Isosa's so busy. She says, what?
No, that's Brenda, right? Brenda, you can go to therawgirl.com and that's where all of the stuff is. But if you go to classes and you click on the button that says classes or programs, it'll take you to stayingagelsuniversity.com, and that's where I have a hormonal balancing academy, and that's where I deal with a lot of women with hormonal issues. So we help women with fibroids, endometriosis, adenomyosis, PCOS, infertility, all kinds of crazy stuff. And we've had exceptional results. So you can check us out there.
Now, I'll put therawgirl.com in the chat. Can they find all that stuff from there?
Mm-hmm. Yep.
Hold on a second. And I'm going to just go to the, let me just I'll do a screen share and share the website with everybody. Hold on one second. Here's a website, drawgirl, drawgirl.com. I put that in the screen. I also will make a little sticker and put it on the screen as well so you guys can find it. So that's drawgirl.com and you can find it. So it's there. So let's see, we get a few more questions before we sign off. Let's see, laugh out loud. What are some foods? Oops. What are some foods that you personally consume daily? I eat a big salad with locally grown greens. I'll have, sometimes shredded carrots and things in it. Today I had, we call the Montgomery salad, had, greens and olives. I consume a lot of sprouts or microgreens in my salad. And I also consume a good number of other foods, seeds. I'll do chia seeds and some foods, hemp seed. We do a lot of pumpkin seeds in the foods I consume. They may be like in a dressing or something like that. And then I try to do bitter herbs. I've kind of slacked off on my bitter herbs lately. I'm going to get back on the bitter herbs. I need to do more bitter herbs, but I've done bitter. Sometimes I'll do neem leaf or neem bark. Those things are extremely bitter. But that's what I do. It's also, how about you?
Well, how I eat depends on where I am these days.
That's fine. You're a jet setter.
So because I'm living between the United States and Africa, like when I'm in the States, and also like it's been wonderful to be here in Houston and the weather is glorious. So whenever the weather is glorious, I can eat raw and I feel really good on raw. If I'm cold, I don't do as well. My body doesn't do as well eating 100% raw, but I do eat a lot of raw food. So since we've been here in Houston, I've been eating a lot of your food, Dr. Montgomery, at the Garden Kitchen. And
thanks for the shout out at the GK.
And that's been glorious. I've been feeling amazing. But when I'm in Africa, what I have to do is I have to try to balance the potential parasitic infections, bacterial infections, and all the other challenges. But I still have, so we tend to cook our vegetables, but we get them fresh. We get them from the market. We also have a garden. I eat a lot of fresh coconut while I'm there too, so that I can get something that's raw. I eat a lot of fresh fruit because the fruit in Africa is incredible. It tastes way better. There's no point in eating a mango in America, child. Please take your butt to Africa. Get you some mango, some pineapple, coconut. It tastes completely different. So I eat a lot of fruit. And then we actually bring a lot of our vegan, convenience food over to Africa because there's no Whole Foods, child. You just go to the market and that's it. So we bring certain things like, bean flour pasta or whatever it is that, things that are convenient that we can't get here, we bring them there. But I'm always improvising. I tend to cook more there. And then when I'm here in the States, I'm trying to be raw. So.
Wow. So that your environment dictates it, but you still can stay on a healthy diet. You just have to maybe manipulate it a little bit from one environment to the other.
You have to manipulate it a little bit, and then I have to be really careful with and we still eat salad and stuff too. It's just you really have to wash your vegetables. So it's a whole process of soaking in vinegar and washing because I wish I had a picture to show y'all, but it's like if I go get a potato from the market, the potato just came out the ground. It didn't just it's not the same as getting a potato in the grocery store. So we got to get all the debris off of it, wash it properly before you. So that's a whole job in itself before you even start, before you start cooking or.
But there you're dealing with a richer, healthier soil. So that potato out of the ground. I mean, here we got toxins in our soil. So I mean.
Well, so the soil is healthier, Dr. Montgomery, but then you got to deal with the problem is sanitation, right? So you can get sick from, there's a lot of people getting, various bacterial infections and different things because of the sanitation issues, because there's too much like sewage around, there's too much. So that's where you got to be careful, and that's where you have to be extra cautious about cleaning your stuff.
Gotcha. Let's see here. So we're talking about calcium oxalate. Stop eating animal protein, number one. Some greens can really cause calcium oxalates. It's best to detox first before switching to a plant-based diet, get toxins out of well. We've detoxed thousands of patients, and most people tolerate getting on a plant-based diet as a detox. We can make minor adjustments, but our experience has been most people tolerate it very well. A lot of people that have trouble early on are people with immune, uh, uh, autoimmune mediated inflammatory diseases that affects the gut bowel. So inflammatory bowel disease or different types of inflammatory conditions of the bowel. And in those situations, we'll put them like on smoothies or cold pressed juices where there's less digestive effort for the body. And then as their GI tract heal, then we can add more plant foods. And so that's been our experience with patients. But for the most part, the GI problem is if you have a disease, inflamed GI system, those people have the most difficult time because it's, you have to deal with that head on. I'm on a carnivorous diet, was able to reverse my type 2 diabetes. I was wondering if I'm having oxalate dumping, detoxing from a year of high oxalate. It's possible. But oxalate plants, really you have to eat a large amount of oxalate plants. I mean, people talk about spinach and kale can release oxalates, but I think you have to eat a large amount of it. So thank you for being an informative element for the change of better health, healing, prevention. Thank you very much, Al King. And Gray's been commenting a lot. I have adrenal gland tumor, checked every few years. What can I do? These adrenal gland tumors, I've treated a number of patients with it. And what I'll say is this, that a lot of people have adrenal gland dysfunction, quote unquote, whether or not we find a tumor. And so I've had patients with one patient comes to mind, she has severe hypertension, blood pressure, 240 over 140, heart rate in the 100s. We had her in the hospital. She was on 10 different medications. We did every test known to man. We did, we checked for pheochromocytoma, renal stenosis. We did imaging of the adrenals and all of that stuff, looking for pheochromocytoma and adrenal tumor. And what we did is we did something special. We measured the adrenal output. I got my interventional radiologist put a catheter in her adrenal veins, and we measured the amount of adrenaline put out by one adrenal versus the other. And one adrenaline is put out like 150 times the amount of adrenaline than the other. And both looked normal on MRI, et cetera. But I got my colleague, and she was in the hospital for a better part of, actually 60 days, to be honest, in total. And we said, let's take out that adrenal. So I got with my urologist colleague, and so we went endoscopy, took it out. Her blood pressure plummeted after. And after that, it was easily controlled with one medication. And it was a challenge, but we addressed that problem, and she did well. I've since saw maybe a handful of other patients with a similar problem, and they weren't as severe as her, so we're going to have to take the adrenal glands out. I think we only removed maybe 2 more adrenal glands based on that. I should have written it up. But when we looked at it on the pathology report, it didn't show anything like pheochromocytoma, et cetera. It just showed hyperplasia. In fact, they didn't use the word hyperplasia. They said increased medullary prominence. They said it was definitely abnormal, but it didn't look like anything else, such as pheochromocytoma or hyperplasia. So she had an abnormally functioning adrenal gland and wasn't responsive to the feedback measures. So it's just putting out adrenaline as though, it heard or saw or responded to nothing. And so the pressure was high and we had to remove it. We've seen other patients with similar type phenomenon, and they responded well to detox. So I think metabolic imbalances probably contribute to this. But yeah, adrenal gland tumor, yes, you may have some abnormal output, but if they're able to control your blood pressure, without having to remove the adrenal gland, that's good. What can I do? I think you need to detox. I mean, I hate to sound like a broken record. I think you need to detox. Looking at adrenal gland function, looking at cortisol levels, looking at the biochemistry, I think is all important. But the tumor is there because of some excess growth. It could be due to some metabolic problem, toxic involvement, etc. Because you don't have to go through surgery. I think the simple thing to do is detox, and then you can start to look at other possible approaches. Yes, I need to put an order in the Garden Kitchen. Yes, Aaron, Garden Kitchen, thanks for the shout out. Garden Kitchen has delicious food. Yes, thanks for the shout out. My brother is always crazy. I think it's the adrenal. Yep, that's true. That's some things you can do. If you're in the Houston area, give us a shout. We can help you look at some of the details. This salsa is great. I mean, we've gone over time. I think it didn't feel like we've gone over time, but it's always a great time. And thank you. Everybody give Salsa a digital round of applause for coming back and joining us. She came
Thank
all the
you.
way over from Sierra Leone to the United States and come to Houston and say hello to you guys. Made a special trip. So thank you very much for coming and joining us. And Daniel has a lot to say about spinach leafy greens. But I think we're out of time right now. I want to thank you guys. Thank you, folks. I'll see you backstage. I'll close out, and we will.
Thank you.
Y'all give her applause. Thank you very much. I'll see you backstage. So again, as usual, I learned a lot, and I hope you guys have learned a lot. And as I've said before, give us a thumbs up. Please share and subscribe if you hadn't had a chance to do so. But share this information with anyone that you think can benefit from it. What we try to do is give you an understanding for the underlying mechanisms of disease, underlying mechanisms of health. So if you understand something, you really understand it, then you own it. And once you own it, you can truly deal with it. So I hope this has been helpful for you. We will be back next week, God willing, and we will have a wonderful show for you at that time. I don't have the title tonight, but it'll probably be related to fatty liver disease. So stay tuned. But until then, keep it fresh, natural, and live.